The Portfolio Diet is an evidence-based eating plan for lowering cholesterol. In this video guide for healthcare providers, we will discuss what foods are part of the Portfolio Diet, what is the evidence behind the Portfolio Diet, and what resources are available for you to support your patients in implementing the Portfolio Diet for cholesterol and cardiovascular risk reduction. The Portfolio Diet is a plant-based portfolio of cholesterol-lowering foods. It consists of 5 pillars, each of which carry health claims for cholesterol or coronary heart disease risk reduction in Canada, the United States of America, and/or Europe. When combined, these pillars have an additive effect. These 5 pillars are nuts and seeds, plant proteins from soy and beans, viscous fibers such as oats and psyllium fibers like Metamucil, plant sterols, usually in the form of supplements, and heart-healthy oils or monounsaturated fatty acids. Individually, each pillar lowers LDL-C by 5 to 10%. Together, they result in a combined LDL-C reduction of about 30%. What is the evidence behind the Portfolio Diet? The Portfolio Diet has been shown to have drug-like LDL-C lowering efficacy. In a 4-week head-to-head randomized controlled trial conducted by Dr. David Jenkins and colleagues at the University of Toronto, the Portfolio Diet was shown to have a 30% reduction in LDL-C, similar to 20 milligrams of lovastatin, making the Portfolio Diet an excellent option for patients hesitant to start pharmacotherapy. In a subsequent larger multi-center trial, the Portfolio Diet adopted a near 50% adherence still resulted in a clinically meaningful 15% reduction in LDL-C. The study also demonstrated cholesterol lowering directly relates to adherence to the Portfolio Diet. Thus, even partial adoption of the Portfolio Diet alone or as add-on therapy to statins can lead to important improvements in cholesterol, making it realistic and feasible for patients to adopt. Finally, meta-analyses show that the beneficial effects of the Portfolio Diet extend to multiple cardiovascular risk factors beyond LDL-C, including clinically meaningful reductions in blood pressure, inflammation, 10-year cardiovascular disease Framingham risk score, and other aspects of the lipid profile. To help clinicians share the Portfolio Diet with patients, multiple resources have been created. Printable patient infographics reviewed and supported by the Canadian Cardiovascular Society are available for patients in both English and French. They can be accessed using these QR codes. Recently, the Portfolio Diet app, an education and engagement tool, was developed to support clinicians and patients in adopting the Portfolio Diet. It consists of a multitude of app features, including diet and health tracking, tailored messages, gamification, and community support, each of which was developed with integration of behavior change theory. Scan the QR code here to access and explore the Portfolio Diet app. To explore the scientific evidence behind the Portfolio Diet and the app, you can scan the QR code beside publications in this infographic. The Portfolio Diet app helps support the patient-provider relationship. It helps patients track their adherence, learn about the diet, and explore fun and tasty ways to implement the diet with recipes. It also helps providers find resources for patients, learn about the evidence, and find supporting guidelines. To support patient-provider relationships, the Portfolio Diet app serves as a conversation piece. Patients can share their diet and health changes with their provider using the app, while providers have a framework to counsel on behavior change with little at a time. The cardiovascular benefits of the Portfolio Diet are recognized by cardiovascular, diabetes, and obesity guidelines internationally. Thank you for watching the Portfolio Diet Guide for Healthcare Providers. This video is supported by the Canadian Cardiovascular Society.